And you've heard it called the Great Resignation. Industries are changing and quickly as millions of us reevaluate work. We've been talking to Northeast Ohio companies to see how they've reacted. Sarah Schuckman reports.
A lot of us have stepped up to the plate and said, what can we do? What can we do? What can we do?
24 years into her nursing career at Akron Children's Hospital, Denise Lehoski has seen busy days. But now staffing shortages hitting healthcare and other industries are compounding with more sick kids in need of care.
Our volumes are just exploding.
To handle it all, nurses like her who work in administrative roles are now volunteering to be back at the bedside.
People are changing around their weekends. People are changing around their days. And we do that because we care about each other and we care about the patients that we take care of.
Lehoski is one of thousands of Helping Hands, as it's called, a voluntary paid program to deploy staff members with clinical skills to work extra hours addressing critical patient needs.
So if the staff member has some available time outside of their regular duties, either in the evening or on the weekend, they can choose to pick up whatever shifts they're available for. We were overwhelmed with the response to the Helping Hands. You know, we expected maybe 100 people, and to get 700 out of about 6,600 employees, over 10% of our workforce, to step up and say, we want to help, we want to do more.
With 500 open positions across nearly all services, the hospital needs the help. Management is actively recruiting retired workers to come back on a temporary basis, recruiting nursing students to come work under registered nurses, and hanging the Help Wanted sign everywhere. This as they balance the stress on the staff they have that's been asked to stretch for 20-some months.
The impact is going to last longer into the future. It's not going to end. That stress that they're feeling and the need for us to provide services for resiliency and well-being for our staff is going to continue into the future.
They've launched a so-called resiliency card to boost energy in the short term and a meditation program to help address long-term wellness.
I think against burnout, against the stress of the daily job, against the things that they're trying to balance not only in the workplace but at home.
Do you feel like you have to be ready for anything right now?
Right. Nothing is following any kind of trends we've seen in the past. So we need to be prepared for anything.
They're expecting a winter of respiratory illnesses, even if COVID cases remain controlled. Lehoski says they're all stepping up out of compassion, and they hope families will show some as well.
You know, people do know that we're in a pandemic right now. People do know of the shortages, but if you actually have to step foot into it and seek care, you know, there just has to be a little bit of patience and understanding that we are doing absolutely the best that we can do to try to take care of you.
There was Sarah Schuckman reporting. Okay, so Children's is hiring for a variety of entry-level and skilled positions, including many impactful roles that support the work of direct caregivers. You can log on to WKYC.com to look for openings.